Tonight's commission meeting on this 18th day of March 2020. If you would all join us for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under.
I'd like to welcome you out. A couple of announcements real quick. Glad to see the social spacing and people taking, their space basically pretty serious, and we appreciate that. We have, this is streaming, as most of you know. Emory Telecom as well is recording this. They are not here in chamber, but they are recording it as well. So with that, any other statements on this? Or okay, we'll jump right into the agenda items. First one is the, on the list here is presentation of Tourism Super Service Award. Did you want to talk this one, Casey?
Commissioners, just because of the situation, we figured it was best to postpone that until we're no longer social distancing at a better time. So.
Okay, great.
So motion to table.
Second that motion.
Okay, all in favor?
Aye.
Aye.
The next item is the approval of minutes. We have 2 sets of minutes, I believe. The first ones are from Wednesday, February 19th, 2020. Any changes or recommendations there?
I have none.
I have none.
I'll make the motion we approve the minutes for February 19th, 2020.
I'll second that.
All in favor?
Aye.
Aye.
Motion passes. The second set of minutes are from the last commission meeting on Wednesday, March 4th. Again, any changes or recommendations there?
I saw no corrections.
I have none.
Okay.
I'll make a motion to approve.
I'll second.
Okay, a motion, a second. All in favor?
Aye.
Aye. Motion passes. Okay. So at this point, I'm going to read the third item here. It's consideration and possible ratification of the Southeast Utah Health Department's declaration of local public health emergency and consideration of related items. We are not doctors. We don't play one on TV or anything like that. So we've got the real professionals here. We're hoping that Brady from the health department, Greg Cook, CEO, and Dr. Engar could come up and talk, and as well as Justin, our own EMS director.
Morning, commissioners, or afternoon, it's a long day. So with this item, one of the things that I believe goes with this is the Carbon County declaration, emergency declaration for the COVID-19. I believe you guys received a copy from Christian today. The purpose for this isn't, and I'll let the professionals talk about it itself. The reason we are doing this declaration, first off, is to provide any funding that might come out of the federal government. This opens up the doors for that to come in. And two, the Small Business Association, this opens the doors for the businesses within Carbon County to go after those low interest loans that have been identified and opened up by the governor. So it's not to cause panic by any means. One of the biggest things that we've seen from this isn't, obviously, we have no cases of COVID-19 in Carbon County right now. The biggest thing that we're seeing is the public going out and causing the panic themselves. So we'd really like to encourage people to limit what they need. So if you go to the store, we're asking people to buy what they'd normally buy. We haven't disrupted the food supply or anything else. The only way we disrupt that is if people panic buy and do that themselves. So we're asking people to please just buy what you need, and if you're going to be out and you need to go to the store and you have some elderly neighbors, please offer to get something for them as well. So that's the biggest thing that we're trying to do, is limit to what you need. Be responsible of those around you, and think about those guys. And then go about normal life. We know that this is very contagious. That's been shown throughout all the places that it's been exposed, but we're really asking people, wash your hands, sanitize, don't touch your face. Those are the main things to limit the spread and do what you need to do. So that's all I had. Thanks, guys.
Thank you.
Thank you. Mr. Bradford, we could have you come up, and we're going to do things a little more unusual here. We'd actually like you to come up here at this point because of the streaming video that we have. Want to come right in the middle?
Yeah, come over here.
I don't want to come right in the
You
middle.
can be in charge here.
Do you have any wipes to get this all clean afterward? Commissioners, thank you. And I understand that the last 2 weeks really have been a whirlwind for us at the health department, for our county partners, for the hospital. I'm glad that they're here. I'm glad that we have a partnership of the commission and the county emergency operations. Right now, I will give the public health perspective of where we are and where we're headed, and let Dr. Engar and Greg Cook speak to more of the clinical aspect of it. They have been amazing partners in this, along with Moab Regional Hospital down in Grand County. Right now in Utah, as of 1 o'clock today, there was 53 cases, positive cases of COVID-19, and one of the more interesting sub-aspects of that is Summit County. Salt Lake County has the most cases. Summit County has the second most cases, and a lot of those are travel-related, people coming in, and then the interaction of individuals in that county. And as we looked at that and looked at the trend of positive cases within the United States and the upward trend in Utah, I felt great concern to be proactive in protecting our community from uncontrolled spread of the disease. We do anticipate we will have positive cases here, but feeling that if we were proactive in taking measures that have been demonstrated to be effective in other countries, then that would help to really reduce the potential spread of disease in our communities, particularly considering we get a lot of people coming through on their way to the San Rafael Swell, on their way to Grand County. That leads to a lot of different interactions that will increase disease spread. So as most people are aware, yesterday I issued a closure of restaurants, a soft closure of restaurants. We asked our lodging facilities to not accept new clients, new reservations for the next 30 days, unless they are individuals that are working in our communities. The purpose of that is to, again, reduce the number of times we're bumping into people that we have no idea of their travel history, their positive nature. We're not, increasing the size of our communities by these orders of magnitude that happens on the weekends in the spring. There are a number of other businesses affected by this, and it was a very painful decision to make. I will say that we will the plan is to look at each of those businesses and try to find out ways that we can get them to perhaps a state where the restaurants are, where there can be a kind of a limited interaction with customers based on their ability to provide social distancing in their business. And that is something we will work with each of those businesses over the next couple of days. And so people ask, why these tremendous, and sometimes it seems overextension of power. Why are we taking these bigger measures? And
part of it is because we are learning so much about the disease so quickly. And there's, from a public health point of view, clinically, I think it's fairly well understood, but we know it. So this was done in reaction to what we do know instead of reaction to what we don't know. And we do know it as highly infectious. We do know there's a vulnerable population that is severely affected by this disease. And these actions help protect our healthcare system, help protect those individuals that cannot protect themselves. It's an act of solidarity for them. And it buys us time. It buys us time so that our lab's testing capabilities can be ramped up. When we know, when we are able to test more individuals, we will be able to isolate them. And that has a great impact on disease spread, meaning it has it will reduce disease spread in our communities as we're able to target hotspots of disease spread. Right now, the state public health lab does not have the capability to test, to do widespread testing. So we're having to be very selective on who we test. And that means we do have people that are potentially symptomatic that we'll never know if they have the disease. That's okay as long as those people stay home until their symptoms resolve. So it buys us time for that. It buys us time to understand a little bit more how it affects our young people, how it affects our older individuals. And to know what other social distancing intervention measures countries and cities have taken that are effective and could be implemented in our area. I'm very, very grateful that businesses that are affected have been proactive in partnering with us in this effort, even though they are facing economic loss. Many of them have said they understand that we are looking at preventing the loss of life by doing this. We're constantly looking for creative and innovative solutions to this problem, this potential outbreak. We feel like we have great partnership with other health departments throughout the rest of the state. We have great partnership with our local leaders, and our staff is functioning very well. We're able to answer questions and direct people where they need to go. Not everybody gets the answer they want, but we are ready at this point to help everybody that is in this state of confusion. We hope we're able to clear up a lot of those issues. We feel like the community has come to a point of understanding why now, but we'd encourage those that are still confused to reach out to the health department. I rambled for a really long time, and I apologize for that, but we do know this has been a big deal, and want people to know that we are really, truly looking out for the best interests of our communities.
Question for you, do we have any positive tests in our county up to this point?
No, and we are testing right now between about 5 and 8 people per day between the 3 counties. Again, we're being pretty selective about who gets a test, and we are waiting on results every day, so that can change at any moment, really, but we still have no positive cases. Today, the state public health lab, which for our area had been running most of the tests, was not functional because of the earthquake. We expect that they'll be functioning tomorrow. But some people will wait an extra day for their results.
Any other questions?
No other questions.
Thank you, Brady.
Thank you.
I'll change chairs. And I didn't recognize Dr. Leo Hardy is here as well, so thank you for being in attendance. Greg, put you in the hot seat.
Well, thank you, Commissioners, for the opportunity just to come and tell you what we know and what we're doing about it. So it's important for everybody to understand that Castleview Hospital is prepared. We are responding appropriately, and we're committed to protecting the well-being of our patients, our visitors, our employees, and our community. We are prepared to treat any influx of patients that we receive. We plan for this on a routine basis. We run mock drills to test our emergency plan quite often. We do that for times like this. It tests our capabilities and our ability to mobilize quickly. Last Friday, we determined that it was time to implement our emergency plan. Given the focus and the increased attention that this has received, this wasn't done out of fear. It was done to ensure that we can continue to treat our patients appropriately should things continue to escalate. Our incident command team meets multiple times a day with various directors and community partners. Those community partners are the CDC, the local health department, our emergency management services, as well as our city and county officials. We have received tremendous support from them, and we appreciate that. I'm very pleased with the community support we've received. I want to give you an example of one thing that happened this morning. I received a call from John Houston from Intermountain Electronics. They were offering their expertise and support should we need to expand our isolation capabilities. Their entire team is willing to make the health and wellness of our community a priority should the need arise. It's efforts such as this that make me proud to live in southeastern Utah. Very good conversation with them, and they can change their operations at a moment's notice to assist us if needed. So many thanks to them. As the situation surrounding COVID-19 evolves, so does our response. Let me tell you what the hospital is doing to ensure that we're ready. Out of an abundance of caution, visitors are no longer permitted until further notice, with the exception of pediatric patients, OB patients, or those receiving end-of-life care. We have closed all of our common areas. Those include the wellness center, our gift shop, and with the exception of our employees, the cafeteria. We have restricted access to the emergency entrance only. You'll notice signage that points you in that direction as you enter the campus. We're also screening all who enter the hospital for respiratory symptoms, fever, and travel history. Please understand that we deal with these situations every day. Patients that have viral symptoms come in our hospital routinely, and we treat them often. So this is nothing we're not prepared for. Our team of employees and physicians are trained, they're experienced, and they're prepared for these things. We treat patients, again, with viral symptoms on a daily basis, and we will be able to treat you should you need it. I am extremely grateful to our employees and their commitment to the safety of our community. Everyone is coming together, and I couldn't be more proud. Please know that we will continue to offer urgent and emergent care if you need our services. Our emergency department will not close. Our med-surg unit, our ICU unit will not close. If you need treatment, we will take care of you. All of these things are put into place out of an abundance of caution. We want to ensure that if we get an influx of COVID-19 patients, that we have resources available to treat our patients. And I feel like we've done that, and I'm very proud of our teams and the community support we've received. Any questions? Okay. Thank you.
Thank you.
Thank you.
Thank you, Greg.
Dr. Engar?
Well, thanks, Commissioners. My name's Dr. Engar. For those who don't know me, I'm one of the ER physicians at the hospital here at Castleview. Appreciate the opportunity to talk about, just real quick, the coronavirus, what we need to worry about, what we don't need to worry about. But just to reiterate what Greg Cook said, we're still open for business. Well, we're still taking care of patients. If you're having chest pain, you think you have a heart attack, come to the ER. You know, if you're having appendicitis, come to the ER. So we're still taking care of all patients. But specifically when it comes to coronavirus, those are the ones that, you know, has ramped up everything and we're concerned about. Viruses, just a real quick history, coronavirus has been around for longer than humans have been around. Coronavirus is a virus like any other cold virus. Actually, it's one of the most common causes of cold virus. This specific strain called COVID-19 is a mutated strain, which viruses mutate all the time. And it's a mutated strain that is just more virulent or causes a little more illness or more severity of illness than typically. And so that's why there's a concern for this. Many people that get this illness, more than 80% of people that get this illness, will be just fine. Most of them will have mild symptoms. Symptoms are fever and cough, body aches, a rare, some people have a little bit of diarrhea with it, but those are the symptoms that we see with it. Right now, we're seeing testing all throughout the nation in order to get a handle on it and to get an idea. Hopefully we won't see it in our community. When we had H1N1 a few years ago, we never really saw it in Carbon-Emery community. They have it on the Wasatch Front, but not down here. So hopefully with all the precautions we're taking and with the public health and decisions they've made and with everyone's cooperation, maybe we can avoid having any serious outbreak. One of the reasons that the nation is doing all of these things as far as closing businesses and trying to social distance everyone is so that we don't have a spike. We've learned from other countries that they get a spike in sudden increase in their cases and it overwhelms the hospital systems. And so they have to make horrible decisions like who they're going to let live and who they're going to have die. And it's difficult, and we don't want that in the United States. And so that's why we're doing what we're doing across the nation to help, instead of having this spike, to make it a soft curve so we can take care of everyone that needs that kind of care. So the symptoms, like I mentioned, cough, fever, body aches. If you get those symptoms, especially once we know that it's in our area, if you get those symptoms, that doesn't mean that you need to see a doctor. You need to see a doctor if you're having complications, okay? The complications will be difficulty breathing, severe shortness of breath, altered mental status. Those type of things require a doctor's visit for sure. But if it spreads through our community, we're not gonna be able to handle everyone at the hospital that has that illness. It's a bad influenza cold-like symptom, and you will get better on your own unless you're having the complications. There is no treatment for it. It's a virus. Your body has to get over it. The treatment you can do at home is Tylenol, Motrin, rest, and fluids. You should also stay away from other people. So that's called home isolation or home quarantine. You don't have to go to some quarantine center or things like that. There's been some confusion that way. You just stay at your house. Take care of yourself, stay hydrated, take care of your fevers and cough and symptoms. And how do you know when you're better? Well, you're better, according to the CDC, 7 days, you should not get out of isolation for 7 days after the onset of the illness, plus 72 hours of not having a fever, plus your cough and shortness of breath, if you have that, are going away and getting better. They don't have to be completely gone, but you can't have a fever for 72 hours, and it has to be at least 7 days from when you first got sick. One other option is for people that are tested, and as Brady mentioned, testing is limited right now to certain criteria. So if you think you have it, but you're doing fine, we're probably not going to be able to test you because we don't have the amount of tests. But if you have been tested, you have to have 2 negative tests, which will take even longer in some instances. Typically, the virus lasts about a week or so, plus or minus a few days. Most people are going to get better and just fine. The risks for certain people are going to be higher than others, are those that have chronic lung disease and are elderly with other diseases, congestive heart failure, things like that. Those kind of people need to take extra precautions for sure. We should all take precautions, and prevention is key. Prevention is staying away from other people that are sick. Don't travel to areas where we know it's occurring. You need to do everything you can to wash your hands, try not to touch your face, those type of things. Typical for any virus. You should be doing the same for influenza. This is one of the worst influenza years we've had, but no one's making a big deal out of that. There's been more than 12,000 deaths in the United States from influenza this year. But did you hear that on the news? No, we didn't. Well, that's one reason why I think a little bit of this panic that's going on is overblown. And it's because we've seen this with other viruses. We can handle this, but we need to work everyone together. This one is more infectious, and part of the reason is because there are many people that can actually carry the virus and not even have any symptoms. That makes it more infectious. So I could be walking around and not have symptoms and be infecting other people, unfortunately. We don't know how infectious that is when you don't have symptoms, but it can occur. And that's why it's hard to control. And that's why we're doing everything we can right now to flatten out that curve so that we can take care of everyone that needs to. So if you're at home and you have illness symptoms and you feel like you're getting worsening breathing or difficulty breathing or altered mental status or family members are that way, yes, come to the ER. We will take care of you. If you have questions and you're not, you're sick, but you're doing fine otherwise, call your doctor if you have any questions, and they can tell you what you need to do at that point. So those are some of the important points that we just wanted to make sure we make. And reassurance, this is a virus like other viruses. Yes, it's a little bit more potent than other viruses, but the majority of us are going to do fine with it, and we'll get over it. For the most part, here in Carbon County, I think you're in good hands. The people that have needed to get prepared, Justin Needles and emergency, services, and Brady Bradford and the health department and everyone at Castleview Hospital, we've been working for weeks to get ready for this. And I think everyone that has been involved is ready, and hopefully we're ready for nothing. But if it happens, then you're in good hands. And just kind of help each other out and to be healthy and remind people that no, I'm not offending you by not shaking your hand. We're not shaking hands because we shouldn't be doing so right now. So anyways, any questions?
I had one question. Kind of plays into the fear and the panic that folks have. They watch the news and they'll see that other countries have certain spikes. I know Italy as an example. Can you compare country to country and say that's going to happen here, or are there certain circumstances in that country to give them a higher rate of deaths?
Right. That's a great question. The numbers from Italy are interesting to look at. They do show that younger people don't get it as much as older people get it more, but really what I believe that's showing is that the younger people don't manifest the illnesses. So they just don't have symptoms, so they're not getting tested and that type of thing. We see 80 years and over in Italy was 13.5% was the last statistic I saw as far as the death rate, mortality rate for over 80-year-old people. Well, how many people over 80 are healthy? The majority of 80-year-olds really have a lot of chronic illnesses and are unhealthy, and unfortunately those are the people that are going to succumb to that. So Italy has an older population typically than we do here in the United States on average in that. And so the other thing is we are much more ahead of the game here in the United States than they were. They didn't put any precautions ahead of time like we are now. So they had this huge spike like I was talking about, and it overwhelmed their care system. And so we learned from them, and so that's why we're trying to do what we can now to kind of bring that down. As far as guessing how well we're going to be in the United States or not, we probably travel more than any other country, and so that creates complications, and so that's why the travel restrictions are on. And so hopefully we can learn from these other countries and be better. It's going to occur, but it's just we're going to do the best we can to keep it manageable.
Thank you. Appreciate that.
Thanks. Appreciate you.
Dr. Hardy, did you have any words for us? Did you want to come sit up in the seat?
No, I don't take classes, but
If you can come to the mic.
I want to specifically thank Mr. Bradford for his leadership,
for making the hard call, and for doing what the science dictates for the safety of the aged, for the disabled, for the cancer patients, for those with severe cardiopulmonary disease, for those that are the coal miners with pulmonary disease, and for every other debilitated, at-risk patient. Now, whether I think that that's going to manifest itself like Italy or Hubei, China, I don't know. But I know you made the right call. I think our hospital's been ready for a lot longer than just this particular scenario. The same types of emergency planning went into effect in 2009 with H1N1. Although you didn't hear about it. You probably didn't know about it, but it did. The same thing happened when we talked about West Nile in 1999. This isn't going to go away. We're going to have other ones come. But it's encouraging to me that we've got local hospitals and we've got local physicians, administrators, and others who take the science for what it's worth. And they can make practical decisions, although certainly not economically, helpful decisions for almost every single citizen. And yet, it's not about us, and it's not about our economic situation. It's about those groups of people that we just mentioned. And so I thank everyone. Thank you.
Thank you. Appreciate it. Well, again, did you guys have any comments on this?
Go ahead, Casey.
The only other thing that we thought needed to be addressed, and it was addressed a little bit by Justin, is that we need to make sure that we're not creating the panic by overrunning the stores, by doing more than we should. Honestly, we live in one of the greatest counties in the state. As I've served as a commissioner, and we've had floods and different events that have happened in our community, I have seen that we've always rallied together and we've taken care of each other. This is no different than any other time. It's not a time to go and buy all the groceries and sit in my house and have more than I need. We need to make sure that we're reaching out to those people in our community, the vulnerable populations, call them, make sure that they have what they need to survive for the next couple of weeks while we're in this social separation time. Make sure that they're getting taken care of, and make sure you're taking the precautions if you do take supplies to them, that you're not putting them at risk. Put it in a box, set it on the doorstep, they can come out and pick it up, and then they can wash their hands afterward. Make sure you're taking the necessary precautions to help those that are at risk, and allowing them to stay home where they should be. There's a difference also between social distancing and quarantine, and it was talked about a little bit. When you should be quarantined is when you're showing symptoms. When you're feeling sick, you stay at home. That will help alleviate the spread of whether it's the coronavirus or the influenza. If you're feeling sick, stay home. Other than that, we're asking for social distancing, which means limit your exposure to everyone. If you have to go to the grocery store, it's okay. Go buy the groceries that you need. If you need to go to work with your employers to limit your exposure at your places of employment. And make sure that you're taking the necessary precautions. Wash your hands frequently. Do those things that will help eliminate the spread of the virus or any other virus that might be happening. So again, social distancing is not a quarantine to lock yourself in your home. That is being required or requested of those who are most at risk and those who are showing symptoms. So be conscious of your purchases and be conscious of those around you. If you know of some elderly people or somebody that has immune compromised situations, reach out to them and make sure you're helping them. That's all I had.
I have nothing.
Great. Did you be able to read the declaration, or me too? I can do that. Okay, I'm going to go ahead and read the resolution here, the Declaration of Local Emergency for Carbon County, resolution number 2020-04. Whereas on January 21st, 2020, the Utah Department of Health activated its Department Operations Center in response to the evolving global outbreak of a novel coronavirus, which had not been previously identified in humans and has been found to be easily transmissible for person to person. And whereas the coronavirus, commonly known as COVID-19, has been shown to result in serious illness or death, has affected over 200,000 persons globally, and as of date of this resolution, as of the date of this resolution, excuse me, and has been identified by the United States Center for Disease Control and Prevention, the CDC, as posing a high risk to public health. And whereas on January 31st, 2020, the United States Department of Health and Human Service Secretary Alex Azar declared a public health emergency for COVID-19 beginning on January 27th, 2020. And whereas on March 6th, 2020, Governor Gary Herbert issued a declaration of state emergency for the state of Utah. And whereas on March 12th, 2020, Governor Gary Herbert and the state of Utah's COVID-19 Community Task Force recommended actions to reduce the spread of COVID-19. And whereas on March 16th, 2020, the Southeast Utah Health Department, through its local health officer, issued a declaration of local public health emergency for all incorporated and unincorporated areas of Carbon County, finding an intimate and approximate threat to public health and for the spread of COVID-19 into Carbon, Emery, and Grand counties. And whereas on March 17, 2020, the Southeast Utah Health Department issued a public health order wherein, inter alia, public gatherings of more than 10 persons were restricted. Dining in restaurants was forbidden, and hotels were restricted from letting out rooms to all but essential visitors and local residents. And whereas the State Emergency Operations Centers raised its activation level to level 2, leveled action, and the State Division of Emergency Management and Department of Health activated a joint information system for public information. And whereas the Utah Department of Health recognized COVID-19 and the ongoing and increased person-to-person transmission of the virus as a threat to the health and the safety of residents of Utah, and has activated response plans and protocols to respond to the continued spread of the virus in Utah, which include the plans to work with partners to identify, contact, and test individuals in the state of Utah who have been potentially exposed to COVID-19. And whereas the Utah Department of Public Safety, Division of Emergency Management, State Emergency Operations Center, is coordinating resources across state government to support the Utah Department of Health and local officials in alleviating the impacts to people, property, and infrastructure, and is assessing the magnitude of long-term effects of the incident with the Utah Department of Health. And whereas the state of Utah has implemented the Utah COVID-19 Community Task Force to coordinate the response to the incident throughout the entire state and along levels of government. And whereas the nature of the local emergency is such that the transmission of COVID-19 is threatening and may affect the entire county and present significant risk to health, safety, and welfare of Carbon County residents. And whereas emergency response operations in Carbon County, along with the Southeastern Utah Health Department, continue throughout the county and are severely straining all responding agencies and the emergency operations plan in effect. And whereas the cost and magnitude of responding to and recovering from the impact of this event is far in excess of Carbon County and the city and its city's available resources, and where these conditions do create a state of emergency within Carbon County according to the local and state statutes, and whereas proactively implementing mitigation measures to slow the spread of the virus is the best interest of the residents of Carbon County and its people. Now, therefore, the Carbon County Board of Commissioners does hereby resolve, declare, and proclaim to the Governor of the State of Utah that a disaster situation and state of emergency exists as defined by the Utah Code annotated section 53-2A-204 through 207 within the entirety of Carbon County due to the aforesaid pandemic, and it's declared to be an emergency required aid, assistance, and relief available pursuant to the provisions of the local and state statutes. The Carbon County Board of Commissioners does further ratify the declaration of local public health emergencies issued by the Southeastern Utah Health Department on March 16th, 2020, adopts its findings and recommendations, and declares its support for the local health order issued by Southeastern Utah Health Department on March 17th, 2020. This declaration shall be filed in the Carbon County Clerk, or with the Carbon County Clerk, and shall take effect immediately and shall continue for a period of 30 days or until revoked, whichever is earlier. So, Commissioners, that's the resolution.
Before we ratify that, I just want to add one more thing. The other reason for passing this declaration is that there is potentially some money coming from the federal government to help our local businesses that might be impacted by shutting down and taking measures that they're being asked to. So this also allows for state and federal assistance during this time, not only with the help of controlling and isolating the coronavirus, but also for helping our local businesses get some access to cash to help them not go under. So that this is twofold for the declaration.
I'd just like to say thank you to Christian Briner, our county attorney, and staff, and the hospital, and the health department for everything that has happened over the past few days that have brought us to this point. And you know, our community is small enough to do the right things, and we all know each other. It's a real advantage to us to have the closeness that we have in our community and the ability to communicate freely amongst each other and come to these kind of conclusions that are the best for the community. None of this is one-sided. It's been an effort by everybody to make this the best safe place for all of our citizens. So just thank everybody.
Yeah, and just to be clear on this as well, this is an emergency resolution. However, let's not get caught up on the word emergency. I think there's enough kind of concern, fear, panic, overreaction. The reasons we're doing it, as Commissioner Hope stated, is just for the benefit of local businesses here. You know, we have an award-winning hospital here. That wasn't the case several years ago, so appreciate the staff and what you guys have done. Brady, your help and advisement on this as well. It's been tremendous. We do have a great community. The people that come to this area, they're just amazed by the friendliness that they receive. We are good people. We don't agree on everything, but I think that's very healthy. But at this point, let's maybe turn the TV off for a day or two and go check on your neighbors, see how they're doing, see if they need anything. I think that's what communities do. So thank you, guys. So with that being said,
I'll make the motion we adopt resolution number 2020-04, a declaration of local emergency for Carbon County, Utah.
I'll second that motion.
okay, have a motion and a second. All in favor?
Aye.
Motion passes. Thank you, guys. Appreciate it. We'll move on to item 4, open sealed bids for the weed and mosquito abatement chemicals.
We've received 2 bids. First one's from IFA. There's several chemicals listed and various prices mentioned.
Seth, I think with these, it'll be difficult to even begin to process them. So why don't we open both, acknowledge who they're from, and then allow Chris Rowley, our weed supervisor, and myself to review those and make a recommendation.
The second bid is from Wilbur Ellis.
Who is it?
Wilbur Ellis.
Wilbur Ellis.
Came from West Bountiful, Utah. So Those were the two bids for the weed.
I'll make a motion to acknowledge the bids and turn over for review and award, subject to the costs.
I'll second that.
Okay, motion is second. All in favor? Number 5, open request for proposals for development of new carbon corridor visitors guide. Seth, do you have more quotes?
Yeah, it looks like we have two here. The first one's from Creative Marketing Design. Again, probably best just to acknowledge the bid on this, I would think. The second one is from Hub, I believe is what it is. Yeah, that's what it says is Hub.
There's no other discussion. I'll make the motion that we have Casey and Tina Henry review those and make a decision on accepting one of them.
Commissioners, before you finalize that motion, you might remember that we put this out to bid about a month and a half ago and did get some other bids previously. We decided to go ahead and open it up one more time. We told those companies that submitted bids previously that their bids would be, that their proposals would be considered along with this new batch of proposals and that they wouldn't have to resubmit. So the motion should include consideration of the items opened tonight as well as the items that were opened previously.
I'll add that to my motion to add those previous bids in.
I'll second that.
Okay, a motion and a second. All in favor?
Aye.
Aye. Motion passes. Item number 7, consideration and possible approval of license for vehicle access across county tax.
At number 6.
Oh, sorry, scratched off the wrong one. Number 6, open request for qualifications for advertising agency for Carbon County Tourism Department.
We also received two bids. This first one's from, it's actually Hub Collective, I guess is the full name of the business.
And again, this will be similar to the last one where we had bids received last time.
And then the second one's from Creative Marketing Design.
Again, I'll make the motion to acknowledge these two bids and to add to them the previous bids that were received and allow Commissioner Hopes and Tina Henry to review those and award.
I'll second that.
Okay, I have a motion and a second. All in favor?
Aye.
Aye. Motion passes.
If I can add just a little bit, these will also be reviewed by the Tourism Tax Advisory Board, both number 6 and number 7 on our agenda, and they will give a recommendation as well. So, perfect.
I was so excited for number 7, now I can do it. Consideration and possible approval of a license for vehicle access across county tax parcel number 02-0903 to Carbon County Raceway on tax parcel 02-0903-0008. Christian, did you want to talk to this?
I can, just for a minute. This is Commissioners, as you know, the entryway into the Carbon County Raceway, I believe, that's owned and operated by Harvey Howard. That entrance into his property goes across Carbon County property. There's an undeveloped, basically a dirt road that goes across our property that allows entrance into his property. We've been asked to consider granting easement rights into that. My recommendation is, at this point, it should also be noted that the parcel across which this little roadway goes is part of a much larger county parcel. And so, in speaking with some of you individually, it's my understanding the county may at some point want to divide off a portion of this parcel, or we may want to make several parcels out of this larger parcel. And until we do that, I would recommend we not grant a full perpetual easement across our property, but simply grant a license to use that roadway for now for the purpose of accessing the raceway, with the option of perhaps developing that into a full-blown perpetual license at some point, or even a sale of a portion of that property. So to that end, I would recommend you grant a license to Harvey Howard, and whoever the owner, if the ownership should change ever in the future of the Carbon County Raceway, that license be extended to that new owner for the sole purpose of going across our property to enter the property used by the Carbon County Raceway, and just for the purposes of that are associated with the Carbon County Raceway. And it would, what I'd recommend is that the license agreement last only for as long as you're willing to grant it, but it could be, it could be an indeterminate amount of time for now, initially, with the right to terminate it if you needed to. The Carbon County would not agree to provide any maintenance to this roadway. The grantee would have to agree to comply with all laws that might pertain to the roadway, and we would not make the grant or the use of the license exclusive. Well, I guess we could make it exclusive just for this, but if we needed to get onto the property for ourselves, we could use the roadway for our own purposes. So those would be the terms of the license for the use of the roadway that I would recommend you grant at this time. And probably also that in the event of a sale or subdivision of the property, that the grantee have the first right of refusal to work with us to receive that roadway for future use.
Okay.
Okay, thank you.
I don't see a problem with this.
I don't either.
I'll make a motion to approve the drafting of a license for vehicle access across county parcel tax number 02-0903 to the Carbon County Raceway on tax parcel 02-0903-0008.
I'll second that.
Just before I say, do we need to clarify as far as length of time for that license, or having the other purchaser possibly have first? Do we need to add that language in this motion?
Well, no, I think you could just reference what I mentioned if you're okay with that, the terms as I listed them, unless you want to vary from that and set a specific time for which license would be in existence.
I don't think so.
No.
Okay, so we have a motion and a second. All in favor?
Aye.
Aye. Passes. Item number 8, consideration and possible approval of donation to the Farron Junior Livestock Show.
Come on up, Joe.
Thank you for having me come.
If you could, just for the record, could you state your name?
Joe Jensen.
Thank you.
I don't have a formal speech or anything, but I know that in the past, the Carbon County Commission has sponsored it. I know the Emery County Commission has. We have a few students show, both in 4-H and FFA, now that they've got the FFA program going. We have several board members from Carbon County that help us out and direct the show. So anyway, I would like to request that you maybe find some funds that you could help us out. Do you have any questions?
Is there any dollar amount that you are asking for, or?
I think typically in the past, it's been like $1,000.
Do you know how long ago that was?
I think last year, I think it was sent.
Do you, Seth?
I didn't check before the meeting, I apologize, but I don't remember a donation last year, but I could definitely check on that.
Just Steve?
There has been for at least the past 3 years.
I've been with the stock show. I just checked for 31 years now. I've been a member of the board, and I know in the premium books they've always mentioned the Carbon County Commissioners by name, thanking them for their help and support.
Okay. Okay.
Well, there's no question we're broke.
Yeah, and I understand that. And
But
when you was talking about getting help with the government, I kind of felt a little bit guilty about asking, but
part of my thought is, Joe's, I'd be happy to personally donate towards it to help you, even if we're not able to as a county. Where in the past we've had lots of people come and ask for donations, and the county had funds and has been pretty generous for lots of years, and so it's just a big concern for us to extend to some and not to all.
yeah, and I understand that.
So that I kind of have some reservations just because of that, because we have told others no
Yeah.
already this year and even last year. So
Do you know if those donations came through the extension agency? Was it the commissioner or was it the extension agency that gave those funds?
Come on up, Steve.
Please, so we can get it on the record.
My name's Steve Price. I'm with USU Extension in Carbon County. So in the past, the county has donated to the Livestock Show Committee for many years, but those funds have been put through USU Extension, although we're not specifically tied with the Livestock Show, and then those get sent annually to the show. I think what Joe was asking for is maybe an increase beyond the $1,000 that are currently going through.
So is that's coming kind of out of the money that we help you guys with, out of the extension office?
Okay.
Yes.
Okay.
That makes more sense of where it was coming from, because this is, as far as I can remember, this was the first time they've come and asked the commission. But if it's been going through the extension and the money that we give there, that makes more sense.
Okay, yeah, and I wasn't aware of that either. So
Okay.
they just, the last meeting, they asked me just to come to the commission meeting and what we do, so.
I'm good with that, and don't tell them we gave it to you, because we didn't. we don't need our names brought up. That's perfectly fine. But again, I'd be happy to contribute personally to it and help you out.
Okay, thank you.
Thank you.
Thanks, Joe. Thanks, Steve.
Okay, item number 9, discussion and possible approval of the July 4th Lannis fireworks contract. Mr. Frank Ori.
All right. Thank you, gentlemen. Under normal circumstances, this is the point in time where we'd ask for the signing of the contract with Lannis Fireworks, but we're anything but normal right now, so we would like to table this until a later date. We have the contract in place, and it's the same thing we've asked for in the past 4 or 5 years, $10,000, and we have money budgeted. But we'd like to just table this until a time where we know we can have a fireworks show.
Okay, I'll make a motion to table until
Further
restrictions
notice.
are lifted.
Okay, we'll be back another time.
I'll
Thanks.
I'll second that.
Okay.
Thank you, Frank.
Thanks, Frank.
No, thank you, gentlemen. Have a great evening.
You too. We have a motion and a second. All in favor?
Aye.
Aye.
So table that. Item number 10, consideration of and possible approval of the Utah State University and Carbon County agreement.
That's you, Steve? Come up.
So I'm Steve Price. I'm with USU Extension Carbon County. So we kind of had 2 different styles of submissions that we're looking for to get those signed. One makes it a little bit easier in the fact that we don't have to have an annual signing every single year like we have. So there's a little bit more flexibility. We would only have to re-sign that when we have a change. But I don't know which one we're looking at, or what questions you might have is kind of the question I had. So.
Christian, have you seen this agreement?
I've looked at one. Maybe I didn't realize there was multiple ones. There's a standard, I guess my thought is this ought to be something we review, if not annually, at least every 2 or 3 years, every 4 years or so. I don't think we should just set it perpetual, because then we tend to lose track of these things and people forget what their obligations are. And I think isn't the previous ones required us to set forth to make an inventory of what stuff is yours and what stuff is ours.
Yes.
And I don't know if we have that inventory. I don't know that do you have that inventory?
We got
do
one
have it.
last year. We asked for it
we did get
last
it.
year,
Okay.
and we did get that.
But I mean, I think we need to keep that for that reason. So if we're sharing stuff, we ought to be renewing this contract regularly and not just setting it to go. If we're sharing stuff, and if they have stuff of ours or we have stuff of theirs. So that would be my recommendation, is it not just be a one-time thing that we let perpetually renew, but something that we annually or every 2 or 3 years look at again. I did look at the one that looked like it was the new version, the 2020 revised one, cooperative agreement here. Let's see. And that one said no more than 50 years. Other than that provision, everything looked okay. So my thought would be pick a term under 5 years, and that's how often we'd go review it.
And honestly, the reason that they've kind of allowed us those 2 different versions is just some counties liked that they didn't have to sit down and really look at it each year. But USU Extension, we're fully supportive of either either one.
Sure.
We're here to help y'all. So.
All right, thanks.
Yeah, I don't know that it needs to be annual, but just periodic at least.
You have a recommendation every 2 or 3 years?
I'd say maybe every 3 years. We bring
Okay.
it back here and look at it.
I'll make the motion that we adopt that alternate contract with them that would make us look at it again every 3 years.
I'll second that motion.
Okay, we have a motion and a second. All in favor?
Aye.
Aye.
Motion passes.
Thank you.
Thank you,
Thanks,
Steve. you'll make sure we get it. Christian will need to review it, and we'll get it signed.
Thanks.
Item number 11, consideration and possible adoption of ordinance 533, a change to the Carbon County zoning district map from RR-2.5 to RR-1, located at 1389 Southeast Coal Creek Road for Mitchum and Deborah Curtis.
I can speak to that. This is a farm that is owned by Mitchum and Deborah Curtis. They have a desire to take their residence and make the residence a 1-acre lot that's separate from the rest of their property there. And the Planning and Zoning Commission recommended that we approve it, and I would make the motion that we approve and adopt this ordinance 533 to change the zoning district map from RR 2.5 to RR-1.
I'll second that motion.
Okay, we have a motion and a second. All in favor?
Aye.
Aye. Motion passes. Item number 12, discussion and possible action on interlocal agreement for Graphite Solar Community Reinvestment Project area.
Rita's missing in action. She's in the back room.
Should be dealing with the coronavirus and keeping social distance. She's not been in the chamber, so we'll give her a minute and let her address this issue.
Do you want me to go check on her?
If you want to, sure.
I'll go grab her.
Yeah.
Oh, there she is. Okay, you'll have to wait for Commissioner Jensen, who just went to grab you, so.
Oh, he did. Where did the tree go so I can get him?
He went that way.
Sorry, guys.
He's probably at your office now. Okay, so now that everybody's present, I'll go ahead and just read this one more time. The discussion and possible action on the interlocal agreement for the Graphite Solar Community Reinvestment Project area. Turn that over to Rita Vigor.
So this is the interlocal agreement for the project that we've been working on with Graphite Solar to build a 70 megawatt solar farm out in Wellington. We've gone to the taxing entities, the other taxing entities, school district, Prywide, the Water Conservancy District, to get their input and approval on the agreement, and they've all approved what we've submitted. And so we're just wanting to pass a resolution approving the county and the redevelopment agency finalizing that agreement with Graphite Solar, or with the other taxing entities for the Graphite Solar project area.
So we ought to announce exactly what documents these items consist of, right?
Yes, so this one will be a resolution, in Resolution 2020-03 for Carbon County. That will be the interlocal agreement that the county will approve with the redevelopment agency for the Graphite Solar project area. So, and then that's the item we're talking about now.
Yeah, that's the sole item for this agenda
this,
item number.
Right. So
yes, and then the nitty-gritty of the details of the participation agreement and the agency resolution are the next item.
when you convene as the redevelopment agency.
Correct.
So do we have any questions at this point, or?
So this is the one we talked about. I came and talked to you guys individually and Christian about the 3% admin fee that wasn't included in this. So that was my main concern, was that when we passed this, we asked for 10% to go toward affordable housing, which is required by law, and 3% to go to an admin fee to help with the management of the tax increment. So I don't know if that's something that we can just ask Adam to, because it's been.
Yeah, I think you can approve it subject to that change being made.
Because it was in all of the other documents, the budget and everything like that. It just wasn't included in this. The 10% is, but the 3% for admin is not. And so I just wanted to make sure that that was in there. Okay. And then, sorry, I looked at both of these, so I can't remember. That was it on this.
Well, I'll make a motion to approve Resolution 2020-03 with the addition of the 3% admin fee, approving the resolution.
I'll second that.
Okay, we have a motion and a second. All in favor?
Aye.
Okay, item 13, adjourn as the Carbon County Commission and convene as the Carbon County Redevelopment Agency.
I'll make a motion to adjourn as the Carbon County Commission and reconvene as the Redevelopment Agency.
I'll second that.
Okay, a motion and a second. All in favor?
Aye.
Aye.
So now that the county has approved the interlocal agreement, this item is Resolution RDA 2020-03 with the Carbon County Redevelopment Agency, basically approving not only the interlocal agreement that was made with the county, the previous item before, but also the interlocal agreements with the school district, Prywide, and the Carbon Water Conservancy District. With this resolution, that's what this resolution states, is that all 4 of those interlocal agreements are approved.
And that's also, so there's a participation agreement, right?
Mm-hmm. Are we doing the interlocal agreement one?
Well, I think they're both, there's two items.
Agreements, the next one.
Yes.
Oh, okay.
There's 2 resolutions within the RDA.
Okay, sorry.
Sorry.
I just wanted, yeah, let's be clear on what documents, then let's list the documents so we know what we're.
So it will be Resolution RDA 2020-03 with the Redevelopment Agency approving the interlocal agreements, the interlocal agreement that was just approved with the county, and the same agreement that was approved with each of the taxing and each of the other taxing entities, all in this one item. So it will be
okay. Great.
I don't have any questions.
This is the one. No, this. Well, no, this is good. Sorry.
Yep.
Okay. It's the next one that has some other issues.
Yeah. So I'll make a motion that we approve resolution number RDA 2020-03, a resolution approving interlocal agreements for the Graphite Solar Community Reinvestment Project area.
I'll second that.
Okay, a motion and a second. All in favor?
Aye.
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 And then the last item, the last item will be the Resolution RDA 2020-04. This resolution is approving the participation agreement, which is the other item listed with this. And this is the one that, as I've talked with each of you and Christian, I had a couple of those issues that, I don't know if you have that email that you can go through the items that we talked about and the ones that you brought up.
Sure. Let me just pull this up here. Okay. So Rita identified a few items. I think the concerns we had in there were that if the taxing, the taxed entity, the company that is doing the project, the participant, right now that's Graphite Solar, I believe.
Yes.
If they were to change ownership to some kind of subsidiary form or to an affiliate or to some other entity, as drafted, it states that they could do that ownership of the entity that's participating in this tax increment program that could be done without the county's consent. It's been, as Rita's made some calls, she's found that what we want to make sure we don't get caught up in is transference of this property or this ownership of the property or the project to a company that is going to be subject to centrally assessed taxes, because then that defeats the purpose of our setting aside the tax increment. So we don't need to, I don't think any of us think we need to completely say that they cannot transfer ownership, but I do agree that we ought to state that transference of the ownership should happen only with our consent. Otherwise, that we risk losing the benefit of this area plan. So that was a great catch by Rita to find that. I think also we want to make sure that it says venue of any court action would be in the 7th District Court of Price, Utah, here in Price. There was a concern, there was just a typo on that part, so we just need to fix that. I'm fine with the indemnity and hold harmless provisions. Those are standard. They state that we'll indemnify and hold harmless each other unless one of us is the cause of the reason for which the loss occurs. And I didn't have any other concerns with that agreement.
And that was everything that we talked about too.
I have no other questions.
Me neither. I'll make a motion to approve Resolution RDA 2020-04, resolution approving participation agreement for Graphite Solar Community Reinvestment Project Area, subject to the venue change from Richfield to Carbon, or to the 7th District Court, and the other changes as noted.
I'll second that.
We have a motion and a second. All in favor?
Aye.
Aye.
Aye. Motion passes. Thank you, Rita.
Thank you, guys. Sorry.
Thank you.
Christian, do we need to reconvene as the Board of Commissioners, or can we just adjourn from here?
Technically, you should reconvene and then adjourn.
I'll make a motion to adjourn as the redevelopment agency and reconvene as the Board of Commissioners.
I'll second that.
Motion is second. All in favor?
Aye.
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 And I'll move we adjourn.
Second.
Buckle up, drive safe. Thank you.